Well, it's a problem that's more common than you might think. Pelvic muscle issues can cause a variety of problems, including hip and back pain. Now, a growing number of patients are tackling that pain by turning to a therapy that builds up a part of the body that can grow weak.
If you could just bend your knees up, both of them, bridge your hips for me, back down.
It's a type of physical therapy that hasn't been that common until now.
Everything in the pelvis looks nice and even, so there's an even pull on those muscles.
According to physical therapists at Makovica Physical Therapy in Omaha, pelvic floor therapy is becoming a more well-known form of physical therapy. The pelvic floor is made up of muscles and tissues below the belly button, like the pubic bone, bladder, urethra, and anus. They assist in maintaining upright posture, supporting abdominal and pelvic organs, and help to control bladder, bowel, and sexual activity. When these muscles become overactive or overused, people can see decreased function, and the result can be painful.
People say that their pain kind of radiates in a circle around them. So by pushing through here, normally I find some pain.
So what is pelvic floor therapy? Pelvic floor physical therapy consists of strengthening the pelvic muscles through exercises and can reduce symptoms of other conditions such as urinary and fecal incontinence, painful intercourse, and sexual dysfunction.
The biggest probably being bowel and bladder dysfunction, whether that's incontinence, constipation, overactive bladder, but we also see people for pelvic pain, tailbone pain, sometimes hip and back pain.
Now, much of that pain in women can be caused by pelvic floor trauma, like from childbirth and vaginal dryness from aging.
The referrals that I get the most often are women who have had a pregnancy and then they have incontinence after pregnancy, or what we call diastasis recti, is just separation of the muscles of the abdomen.
According to research provided by Makovica Physical Therapy, 60% of postpartum women report stress urinary incontinence. 77% of postpartum women had low back pain, and 29% of women who had a vaginal delivery experienced pubic bone fractures. All these symptoms can be treated with physical therapy.
Everyone thinks they're coming in for Kegel exercises to strengthen the muscle, but what we actually do is get everything to relax. A tense muscle will cause incontinence, it will cause constipation, and it does cause pain with intercourse because those muscles are so tight. So 80 to 90% of the time we're working on getting that muscle to relax instead of the actual strengthening part to it, and that's a common misconception that we see.
Another misconception, pelvic floor dysfunction is not a woman's disorder.
Men, women, children, it doesn't select a gender, it doesn't select an age. Pelvic floor dysfunction is found kind of across the board. We actually know right now that the latest statistic says about 50% of people have pelvic floor dysfunction, which is pretty substantial.
Male chronic pelvic pain is a condition that affects 2 to 20% of males. Their symptoms often go unrecognized as constant or intermittent pain in the low back, hips, or abdomen, and often radiates to the testicles, anus, or penis. Pelvic pain can also be tied to other injuries.
So we had a patient actually have a work comp injury where they fell at work, their leg went out to the side. It presented as low back and hip pain, and it was kind of going down their legs. And then as we saw her here, it progressively got worse. And then we actually started treating the pelvic floor side, and that's where she got the symptom relief from.
That's why if something doesn't feel right, a visit to a physical therapist won't hurt.
The biggest part of what we do, especially on the first visit, is just educate people, tell them why they're here, why their symptoms are happening, and then from there people are more open to fixing it because they truly understand the issue.
Now, pelvic floor therapy falls under the physical therapy umbrella with most health insurance, so if your policy covers physical therapy, it should cover this as well. Now, we'll have this story and more details on our website, 3newsnow.com.